So my name is Cassie and my pathology is osteoarthritis, and it affects mostly weight-bearing joints, so we'll be doing a knee x-ray. This is my patient Shelby. Before we get started with the exam, I made sure to ask Shelby if there was any chance of pregnancy, and she did say no. So I would ask name and date of birth to have 2 identifiers, and then I would ask history. Brought you in here today?
Oh, I've just been having some knee pain for about 6 months, no injury.
Any history of knee problems before?
Nope.
I will then ask more detail about the pain that they've been having just to get a better history for the rad. I'm gonna have Shelby go ahead and lay on the table. She did not have to change into a gown because she had no artifact. Since her knee is thicker than 10 centimeters, I will use the table lucky, and the image receptor goes in portrait. I have to get the table and the image receptor all lined up and put into D10. And for an AP knee x-ray, we use 40 SID. There'll be no angle in the tube because her ASIS is in between 19 and 24 centimeters. If she was thicker than 24 centimeters, then I would have to angle the tube cephalic. And then if she was less than 19 centimeters, I would have to angle the tube caudal. I'm going to put Shelby in the right position lined up with the central ray. And for an AP knee x-ray, the centering point is 1.5 inches distal from the apex of the patella. I'm just going to palpate Shelby's knee patella. So since the apex is about right here, I then have to go 1.5 centimeters distal to the apex of the patella. Collimation is superior to include the distal femur, inferior to include the proximal tib fib, and medial and laterally to include the soft tissues. I then place my right marker on the lateral aspect of the knee, then make sure the toe is pointed straight up for no rotation of the knee. Before I go back and take the exposure, I'm going to grab a shield and shield Shelby over her. So now that Shelby is ready for her exposure, I go back to the control panel and select AP knee x-ray. Next, I select her body habitus. Since we are using a center chamber AEC, it tells us that the exposure will terminate when the center chamber has been fully activated. There are no breathing instructions for an AP knee, but I just informed the patient to hold still. The exposure factors for an AP knee are around 60 to 70 kVp and 7 to 10 mass. Now we're going to go to the lateral knee, and I asked Shelby to roll it onto her side. I have Shelby bring this knee over to make it a little bit more comfortable for her and make sure that the epicondyles of the knee are superimposed and not rotated. And I also make sure that her knee is flexed 20 to 30 degrees to show the best image. And then for a lateral knee x-ray, we have to angle the tube cephalic 5 to 7 degrees to show the joint space. And since I did that, I now have to realign the bucky and the tube. So now that the bucky and the tube's lined up after putting the angle, I will then move the table to put her in the correct position. The centering point for a lateral knee x-ray is 1 inch distal to the medial epicondyle. And your collimation is to include all 4 sides of the area of interest, including the soft tissue margins. And then I place my right marker. So now before I go back and expose, I'm going to shield Shelby again. This over top of her. And then I just tell her to hold still. So now I go back to the x-ray panel and select lateral knee, and then I will select her body habitus again. And since we are using AEC, we will be using the center chamber. There are no breathing instructions, I just informed Shelby to hold still. The exposure factors for this lateral knee will be about 60 to 70 kVp and 7 to 10 mass.